patient doesn't have insurance, that's an extra $1,000, $1,500, something like that they're coming out of pocket, maybe to get a procedure that they sometimes don't even need.
Hey everybody, I'm Dr. Alan Williams with the Grapevine Dentist.
And my name is Dr. Daniel Choi with North Texas Dental Surgery. Well, today I want to talk about something that happens every day at millions of dental offices all over the world, dental cleanings, and also to make sure how you're getting the right type of cleaning, to make sure that you're getting the right treatment, and also so that you're not getting ripped off. So basically, when let's talk about basically what happens when you get a dental cleaning over at the Grapevine Dentist.
Sure.
So what happens, right? Like they come in, they go see the hygienist, they get their teeth cleaned, but also importantly too, what they do is they measure their gums, right?
Yeah.
So measuring the gums, like we know that if your gums are relatively healthy and you go see the dentist regularly, then you're just going to need a regular cleaning.
Right.
And the regular cleaning is also cool too, because like it gives you an opportunity to look at the x-rays, take a look inside the mouth, make sure that nothing's gone wrong in the last few months and stuff like that, right?
Right.
Well, so again, a regular cleaning, all we're doing typically is whether a dentist or their hygienist is doing a regular cleaning on you, it's pretty simple.
It is.
Now, what we have also is something you might hear of like a deep cleaning. Technical terms, we know it as a scaling and root planing.
Right.
But what typically happens is that what we do is for, again, a normal dental appointment, what we mentioned for all dental appointments for regular cleanings, we still measure your gums. And so, again, typically if you have 3mm pockets, at worst 4mm pockets, meaning how many millimeters that little measuring probe goes into your gums, typically you can get away with a regular cleaning. However, once you start seeing about 4mm pockets to 5mm and 6s and something like around that area, and you're also noticing some bleeding on probing, meaning some bleeding from those spots, that's indicative of the inflammation. And that means that you have technically periodontal disease at that point, right? And so, sorry?
Yeah, and periodontal disease is linked to so many health issues, Dr.
Right.
Choi.
So in the last like 10 years, really, like there have been all these associations with long-term heart disease, brain abscesses, strokes. It's kind of crazy, honestly, because me being a very skeptical person, when I first started hearing about this in residency back in about 2008, I was very skeptical.
Sure.
But realistically, in my career, in my 10 years of private practice, I have seen patients that have had strokes and brain abscesses at least. Heart disease is such a long, chronic process. Right. It's really hard to say that, that was caused by the gum disease, the periodontal disease.
Right.
So that's another reason to be really on top of like making sure that you're getting your dental cleanings and, where necessary, getting your periodontitis checked.
Right.
So again, typically what we're looking for is 4mm, or maybe 5mm pockets, again, that inflammation, that bleeding on probing. Right. And what we're really doing with the deep cleaning is that we're just actually getting in there deeper where that bacteria is underneath your gums. A prophy is a normal prophy, like a normal cleaning. When you go to a dental office, it's what we call a prophy. Typically it gets a little bit underneath your gums and cleans, your tooth. But when you have periodontal disease, or gum disease, layman's term, you have bacteria that gets underneath your gums, releasing the toxins, causing that inflammation and that bleeding on probing, and then also that's how your pockets get deeper because of that bacteria just releasing the toxins, causing that gum separation. And that's what also allows our measuring stick, that probe, to go deeper in there and measure those 4, 5, 6mm pockets. So the whole thing about that is that, when we do a deep cleaning, we have to typically numb you up because we're getting a little bit deeper underneath your gums, which can be a little uncomfortable. But then we're going in and we're cleaning out all that bacteria that's causing these issues, because the longer those issues happen, again, you can have more systemic issues, or you can get more bone loss. Worst case scenario, your tooth starts loosening. And actually, what a lot of people don't know is that periodontal disease is actually the #1 reason for adult tooth loss, which is very shocking, right? Most people think it's cavities and stuff like that, but it's actually periodontal disease. So it's really important that we're warranted that you actually get your deep cleaning. Now, here's the thing that I really want to talk about though. We know that in the last 10 years, the last 10 years, there's been a rise in corporate dentistry. So what I have seen a lot of times is that these patients are being recommended treatment, like these deep cleanings, that they're not necessarily needing. So
besides the fact of the expense and wasting our insurance dollars, what other, or could there be negative consequences of doing a deep cleaning or scaling and replaning?
Right. So research,
on a healthy tooth?
Right. So research has actually shown that when you do that on a healthy tooth, you can actually get more gum recession. so more of the tooth being exposed. Some patients can get increased sensitivity, and also, in all honesty, it's just not healthy for the tooth.
Okay.
So again, yeah, if a patient doesn't have insurance, that's an extra $1,000, $1,500, something like that they're coming out of pocket, maybe to get a procedure that they sometimes don't even need. So, and also there's just technically it's like some more damage of the gum recession. Okay. So the big question one might have is really, how do I really look out to see that I have gum disease or not, to warrant for me to pay another $1,000 or whatever my copay is for this procedure? That's the big question, right? So typically, again, what you want to ask your dentist, your hygienist is, hey, what were my probing depths?
Sure.
Hey, did I have any bleeding on probing? Can you show me my x-rays? These are the questions that you can ask. And again, if you have any uncertainty about that, then what you also can do is you can get a second opinion from somebody else.
Right.
So a lot of this can be very subjective, so it doesn't hurt to go get a second opinion.
It's important to trust your provider.
Exactly.
Yeah.
And I also want to say another thing is, I'm not to throw people under the bus, but again, because it is very subjective, it's not necessarily that somebody has always got something, they're coming after your money or your wallet, or they have bad intentions. But it is definitely something to be aware of, especially in the rise of corporate dentistry, that we have seen some blurring of the ethics lines and stuff like that. So hopefully you guys found this information helpful, and if you guys have any questions, please feel free to come on in and come see us. Thanks.
Awesome. Thank you guys.